Hi everyone. My late husband's body would convert the carbohydrates he ate to alcohol and he become legally intoxicated. My name is Michelle Giannato. I'm the Vice President and Patient Advocate for the nonprofit Auto-Brewery Syndrome Information and Research. Tonight was a great night. I got a reach out from a woman whose husband is in the ER in a hospital in Texas, and she said, "Can you help me? My husband is here. He ate the wrong thing. His blood alcohol is way over 200. And I said, sure. Anyone that you find, a doctor, a nurse, if they're willing to speak to me, let them know your patient advocate is on the phone. Ask permission to get me on speaker, and I will collaborate with any team member that's willing to speak to me." She found someone. They said, sure, no problem. She put me on speaker, and we were able to go over auto-brewery syndrome, the possible causes, the treatment options, and most importantly, the worst case scenario when you have auto-brewery, like the fermenting bacteria and yeast reaching the bloodstream and the patient going into sepsis. That's not the case here, but I wanted to alert the medical staff of the best case scenario, again, worst case scenario, and the different doctors that would be needed to be pulled in, which infectious disease, and possibly pulmonology, because the patient is having trouble breathing and having problems with his heart. So after we collaborated and I directed them to our website, autobrewery.org, gave them the information that they could download case studies. I also emailed to them some of the most important case studies that detail how to test, and the case studies on non-alcoholic fatty liver disease, urinary brewery syndrome, oral brewery syndrome, and what we do today to test if the patient has it. They were grateful for the information, and they're now reaching out to her primary doctor to try to push this along and get him help sooner than later. Again, very good night. I'm so grateful that I was able to collaborate with the hospital and medical staff that were willing to listen. After we got off the phone, she had texted me and said, "Thank you so much. You have no idea the positive response that we're getting from the hospital and how they're pushing to help my husband. I could not have done this without your group." So again, autobrewery.org, download case studies, reach out to us. This is a treatable disease, and if a patient should call and make an appointment and mentions that they may have auto-brewery syndrome, please don't make them wait 3 to 6 months. They may not have that time. Thank you so much for listening.